This slide shows us the table of contents. The purpose of this study is to educate the audience on the severity of the lead poisoning crisis at Zamfara, Nigeria, and its catastrophic and far-reaching consequences and impact on the community. The objectives are short and long-term health consequences associated with lead poisoning in the community, raising awareness about the lead poisoning crisis in Zamfara, Nigeria, and to call for action and support towards resolving the lead poisoning crisis in Zamfara, Nigeria. This slide talks about the background of lead crisis in Zamfara, Nigeria. The lead crisis, which took place in 2010 at Zamfara, Nigeria, is an ideal example of how a polluted environment poses a danger to human health due to overexposure in children resulting from work environment-related artisanal gold mining activities. The artisanal gold mining activity incidence was caused by artisanal mining using unprofessional and unhygienic measures. The extraction involved a high amount of lead in the ore, thus releasing lead dust into the environment. Impact on the communities. Children were among the victims of lead pollution in many communities. Extent. This is one of the most serious lead pollution disasters in the world. More than 400 children died and others fell ill due to the lead poisoning, as WHO indicated. Lead-term implication. The dangers of informal and uncontrollable mining were demonstrated by lead poisoning in Zamfara. Moreover, it underscored how environmental as well as occupational health roles should be in a position to aid in the prevention of such incidents recurrences in the future. In this slide, the map shows mainly three local government areas studied during the period of October 15 to November 18, 2010, affected by the high level of lead poisoning. The data provided by PubMed shows that the study was conducted across 74 villages, among which 70 completed the survey. Here, 54 of the 70 villages that completed the survey reported gold ore processing. The ore processing villages were more likely to have more than one child under 5 years of age with lead poisoning or death following convulsions, soil contamination, and blood lead levels more than 45 micrograms per TL were seen in ore processing villages only. This bar graph gives us information about a cross-sectional study conducted in the Bagega community in Zamfara State, Nigeria from August 23 to September 6, 2010, which included an estimated 2,450 people with 380 children under 5. The results of this study shows that females had a high level of lead poisoning rate compared to males across all age groups. In this slide, the pie chart outlines the various gold ore processing activities in villages of interest in Zamfara state over the previous 12 months. As seen in the chart, washing was the prevalent activity with 27% of the villages engaging in this step. The findings indicate that huge community participation in all stages of gold mine operations such as rock crushing, washing, drying, and smelting. The huge number of villages involved clearly suggests that broad exposure to health risk as a result of unplanned and illegal gold production practices. This slide consists of the blood and soil lead levels in Bagega community, Zamfara, Nigeria. The study was conducted in September 2010. The table shows that 24.1% engaged in ore processing activities within their premises, indicating a community-wide involvement in illegal coal mining. 59.5% households had elevated soil lead levels more than 400 ppm, suggesting widespread soil contamination with lead posing a potential risk to the residents. For children under 5 living in homes with advanced soil lead levels, 34.2% had a blood lead level of greater than 10 micrograms per DL, indicating a large number have elevated blood lead levels, and 31% had severe lead poisoning with a blood lead level of more than 45 microgram per DL, reflecting the severity of lead exposure in young people. These are the signs and symptoms of lead poisoning in children. Now let's talk about the prevention and control measures. This slide talks about the chelation therapy, that is use of chelating agents to remove lead from the body. This graph shows about the before and after effects of chelation therapy. In the line graph, there is a persistent decline in the blood lead levels with chelation therapy, except for the lead levels rebound seen on day 12 of the therapy, following which again there is a decrease in the blood lead level. The other prevention and control measures are medical and health education, environmental development, safe mining practices, communication and knowledge, and hospital and facility information. Together, these strategies address immediate healthcare needs, prevent relapse, and promote long-term health and awareness in affected communities. The summary concises of all the points discussed previously. These are the references. Thank you for listening.